My name is Elise Antonia Kohl-Grant, originally from Berkeley, California, and I've lived in New York City for about 10 years, so I guess that makes me a flower child at heart with a New York City vibe. I went to school at University of New Haven where I received my Bachelor's of Arts in Communication, and now I am 2 months away from receiving my Executive MBA at NYU Stern Business School. I started off in the technology field where I took my first position as a customer service rep, and I worked my way up to implementation, to training, to account management, where I oversaw several enterprise accounts. And even though I love the technology field and I love the fact that I was able to help these agencies scale their businesses using technology tools, I felt like I was missing something. And I felt like I wanted to impact more people in a positive way. And I thought back to my brother, who's autistic, nonverbal, and he wouldn't get where he was today without the people that helped him along the way. And I thought, how can I provide a voice to folks that might not have a voice, while leveraging my experience with technology? So I started looking at different industries, and I just landed in the healthcare industry, which was kind of perfect for me at the time because healthcare really lacks the technology resources it needs, especially considering how many people that work in the healthcare industry today. I decided to pursue my MBA while I was working at New York City Department of Health and Mental Hygiene. I was one of the directors over there, and I oversaw a $20 million grant program where we assisted about 140 agencies across the entire state of New York with IT infrastructure funds. And it was really when I started going to the meetings with state representatives and local city representatives, and I noticed that oftentimes I was usually the only woman in the room. And I thought to myself, what makes me different than everyone else sitting around this boardroom table? And I noticed a lot of folks had their masters in business administration, or their masters in public health, or their masters in public administration. And that's when I realized I needed to do something more in order to be able to sit in the seat that I wanted to sit in. So I received the Career Development Grant from AAUW because I had just been accepted to NYU Stern, and I had also just started my own business called Gifted Builders, which is an organization that helps agencies implement fitness programs and fitness events to help inspire not only employer morale, but help individuals kind of inspired to live healthier lives. For the last 2 years, I worked as Director of IT Project Management at Coordinated Behavioral Care, where I oversaw the procurement of vendor applications for not only our internal organizations, but 60 of the agencies that we represent across our network. I was recently promoted to be Chief Information Officer of our new venture that we're starting called Innovative Management Solutions NY, where I'll be overseeing the data analytic business intelligence platform. With this platform, we will be pulling data from disparate sources across the agencies that we serve so that we can run analytics across our entire patient population. Not just analytics on the medical side, but analytics on the social determinants of health side. Are folks homeless? Are they living in impoverished neighborhoods? Do they have food on their table? Are their kids going to school? Are their kids doing good in school? These are all factors that influence an individual's health, and we just don't have proper analytics on it. So I'll be working with a team of individuals to create this data analytics business intelligence platform to provide insightful and actionable information to agencies that need it the most. You can't really be a leader on your own. You have to be a leader with a network of strong women, and to create strong women and women empowerment across your community is the only way that we as women can break through the glass ceiling together.